Look forward to our weekly visit with Dr. Joe. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, on board with us this morning. And, Joe, I guess let's first of all go to J.T. Barrett. Supposedly banged pregame with the knee, goes out and plays, and then gets banged up a little bit on the field, has to come out. They're saying trick knee, popped in and out. What do you hear about that?
Yeah, it's a strange story, especially on the sideline pregame getting bumped. I will tell you, it's an odd thing. This is our third year with the high school team I cover with Hoban going to state. There are a lot of new people on the sidelines each week that goes on. Sometimes there's people with passes from the state and other things, and you really have to police that. I guess it was out of hand at Ohio State. But anyway, the point is, what could possibly a cameraman have done that would have bumped his knee, that could have allowed him to play 3 quarters and then have to come out of a game? And really, everything I've read, it looks like probably it was torn cartilage, people have said. I saw even in one interview with Urban Meyer where he mentioned that. That's the meniscus, and the meniscus sometimes gets a type of tear, a flap tear, or what we call a bucket handle tear. I read elsewhere that he had it actually in the Indiana game, week 1. So he may have been struggling with it all year. What happens is this flap sometimes, with just a bump or an awkward movement, can flip into the joint and block you from bending and straightening the knee, and you have to mess around with it, move it around to get it to unlock and to get back to returning to play. And perhaps the bump caused it to lock some, and then later in the game when he had the awkward fall on the field, he got the lock and he walked to the locker room. A bucket handle tear, usually they're fixed as soon as you have about 4 to 6 weeks, because they're pretty easy to just do arthroscopic surgery, fix it, and the person comes back. But during the last month, they haven't had 4 to 6 weeks where they wanted to have J.T. Barrett out, so people do play with it. The only other thing that's close would be a patellar dislocation. He did say that it popped. Sometimes an awkward, even a bump on the sidelines could get the kneecap to pop out, but I don't think that fits the story as well, and it sounds like some people have said this is probably torn cartilage with J.T.
Is this
Barrett.
the thing? Sometimes I hear someone say, he's got a trick knee. Is this what we're talking about? No?
There's so many things, and who knows with colloquialisms like that, with things that, stories that take on the
I
name
love
of
that.
their
You're
own.
taking it from a medical standpoint and a medical phrase.
Yeah,
I like it.
Yeah, but, Ray, I think it probably is, and it's just out there so that people would know. If you'd have an awkward, and people say, I get this, it catches on me, it locks up, it's probably this flap tear or bucket handle tear of the meniscus.
So with that type of thing, is it almost like a snap-by-snap thing? I mean, depending on where he moves, that flap could be a problem, kind of clog up the joint. He may have to check out.
Well, I don't want to make it a little too nerve-wracking for Ohio State, for all of our fans at Ohio State out there about this. But, yeah, it's the kind of thing where it can. And maybe the bump by the cameraman had it, and he's able to get by with it the way he was. He was able to get by. But then it took the more significant injury later in the day, in the game, when he really had to come out. Obviously, you would think that probably Haskins is a lot more ready this week to have to assume the responsibilities if it would happen again.
Earlier this morning, Joe, Tony and I were talking about Derrick Rose, the point guard for the Cavaliers, who's left the team, and we don't know when he'll come back, if at all, dealing with some anguish. One, Tony was reading, had heard he's having some anguish about being away from the Chicago area and some other personal items. It brings to mind about athletes who have to walk away at some point, whether it's physical or mental.
Yeah, it's not just professionals. And in his case, of course, you've got the extra pressure of the $8 million shoe contract or whatever, and other issues like that make it even more difficult. I had to make this decision with a college kid last week. We make it with high school kids sometimes. And you ask me, how do we do it? And there's just some kids that have certain injuries that just won't allow them when they play. They make it worse. It continues to bother them. What we really ask them is, if it's really bothering you, into activities of daily living, to where, gosh, I have to live with pain all the time to play through this thing where I'm at right now, then maybe we really have to think we've done everything rehab-wise. There is or isn't a surgery that could take it any further. We've done all the medical care. Okay, time to talk about, are you ready to call it a career? Are you ready to retire? And we'll have a long talk in my office. It may be a half hour or 45 minutes. I had this last week with a college kid. Okay, we're going to have to probably call it a career. career here. Sometimes there's a lot of tears. There's a lot of emotions. Sometimes there's a lot of other issues with these kids of anxiety and depression that's pent up, because living in pain all the time for some of our listeners that have to, work through things that are painful, that's really tough to do. And if it's contributing, if playing sport is contributing to living with that pain into activities of daily living, then it may be time to call it a career.
Is there a strict medical line that a doctor, for example, like you, looks at and says, we got to have that conversation? Or is this case by case depending on the individual?
So there are both, Ray, and that would have to be the answer. There are times where there's objective findings, like, for instance, in the neck of certain players, where they have a narrowing in the spine and they're really putting themselves at risk, and there's a specific amount of narrowing that we look at called spinal stenosis. All right, we have to go in the room and we say, you're really taking a risk for a significant neck injury, for the possibility of being paralyzed and issues like that. Under our watch, we can't allow you to play. Versus the discussion I said earlier where, hey, this is really spilling over into your life. It's reducing your quality of life. Really time to think about calling it a career. Come back in 4 weeks, talk about it with your parents, your coach, with everybody, and let's have this discussion again. But that is not quite as objective.
Yeah, I imagine it's an emotional time. We hear it a lot of time with professional athletes, but you're talking young athletes who have played soccer or played volleyball since the time they're 6 years old.
Oh, my gosh. Can you imagine? Mm-hmm. They're with their peer group, their team, maybe friends, for a long period of time. Friends. A lot of their identity is wrapped up in that position. So I don't do it lightly, and it's very difficult in the office. And this time last week was a lot of tears. There were a lot of crying, a lot of time to work through that. But a lot of times, and it's kind of heartening to me, people come back later and say, hey, I really appreciate that you had that talk with me. I just couldn't do it on my own. My parent, we couldn't do it on our own. And the fact that you told me looking in from the outside that it really was spilling into affecting my quality of life, very helpful to me, and they appreciate that. So that's part of the role that we play sometimes in sports medicine.
You'll be on the sidelines tomorrow night, Holman against Winton Woods. What do you think?
Oh, my gosh. Winton Woods is a very, very good team. This is one of the best, if not in my 30th year on the sidelines. I'm finishing up. Maybe the best Hoban team I've ever seen. Hoban is very, very good. We've been really fortunate to keep him healthy heading into this thing. Going to so many games in different venues. I've worked some Walsh University games this year in the new Tom Benson Stadium. It's gorgeous. What a jewel. So it'll be great, and it looks like a pretty good night. If anybody wants to see some really good high school football, I think it's going to be tomorrow night.
Stay away from the cameramen on the sidelines, okay?
I will push away the cameramen from some of our players as well.
Hey, thanks for making time for us.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, joining us.